Welcome to The Explainer. Today we're digging into a pretty provocative argument from one source, that the Affordable Care Act wasn't just a reform, but was actually designed step by step to push America toward a single-payer healthcare system. Okay, let's get into it. So to really get this argument, we have to start with something you've probably felt yourself. Depending on which news channel you flip on, you've heard two totally different stories about what the ACA does to your wallet. So what's the real story? Right? On one hand, you see these headlines celebrating that premium hikes are slowing down, but then you see other reports about shocking double or even triple-digit increases. The source we're looking at today argues that this feeling, like we're living in two different realities, isn't an accident. It's actually central to understanding where this is all supposed to be heading. So the first domino in this whole argument is just the massive confusion around insurance premiums themselves. I mean, how can two different people look at the exact same law and come to completely opposite conclusions about how much it costs? Well, the source argues that almost all of that confusion boils down to one single question. Are we talking about the price change for a specific person or the price change for a specific policy? And believe me, that distinction is everything. The source uses a great analogy to make this super clear. Think of it like this. The ACA required all plans to cover essential health benefits, making them way more comprehensive. So let's call these plans Ferraris. Now, if you used to have a basic, affordable plan, let's call that a Toyota. The government basically just told you that you have to go buy a Ferrari. Your personal car payment is going to feel astronomical, right? Even if the sticker price of a Ferrari only went up by a tiny bit that year. And what's so fascinating is that you can see how early government data fueled both sides of this debate. Check this out. It's a projection from the CBO way back in 2009. Opponents of the law could point right here to this 27 to 30% premium spike for people buying their own insurance because they were being forced into those more generous Ferrari plans. At the same time, supporters could point down here to the tiny change for the vast majority of people who get insurance through a big employer. Both sides were technically using the same data, but they were telling completely different stories. And more recent studies cited by the source show just how intense those Ferrari-level price hikes really were. The Manhattan Institute, for example, found that for a typical 27-year-old, the cheapest plan available shot up by an average of 97% for men and 55% for women. Another study found premiums jumped over 24% above and beyond what you'd expect from normal healthcare inflation. Okay, let's move on to the second domino because this is where it starts to build. The source argues that this premium pressure wasn't a bug, it was a feature. It was meant to push a huge number of Americans off of private insurance and onto government-funded plans. And just look at this number. This comes from CBO projections. By 2018, it was projected that a gross total of 38 million people would be moved into plans either run directly by the government, like Medicaid, or heavily subsidized by it, like the ACA exchanges. That's a massive shift. And this chart really paints the picture perfectly. You can see it right here. As millions of people were projected to gain coverage through government channels, that's Medicaid and the exchanges, millions were also projected to leave their private, employer-based plans. It's basically a one-for-one swap. And here's the result of all that. By 2018, if you combine all the federal programs together, the government was projected to be the source of health insurance for nearly 2 out of every 5 Americans. The source argues that this creates a huge population that's totally dependent on the federal government for their health care. Now for the third domino, according to this argument, the ACA was set up to fail on its two biggest promises, universal coverage and reducing the deficit. And that failure, the source claims, is actually a key part of the political strategy. First up, coverage. I mean, it's called the Affordable Care Act. But despite the name and the trillion-dollar cost, the CBO projected that even by 2019, a full decade after it was passed, the law wouldn't even cut the number of uninsured Americans in half. So a promise of universal coverage that, well, it falls pretty short. So what about that promise to reduce the deficit? Well, on paper, the numbers look absolutely mind-blowing. The source points out that more than half the ACA's funding came from this, a projected 52.6 times trillion-dollar reduction in future Medicare spending. But, and this is a huge but, the source argues these cuts are basically a political fantasy. It quotes economist John Goodman, who says that Congress has historically refused to allow even tiny reductions in payments to doctors. The idea that future politicians would ever let these enormous cuts actually go into effect is, in his view, just not realistic. So you put all this together and you get to this crucial point. You end up with a system where more people might have an insurance card in their wallet, but they have a harder time getting actual care. To keep costs down, many of these new plans have really narrow networks of doctors and hospitals, which the source argues leads to longer waits and what it basically calls rationed healthcare. And all of this brings us to the final domino, the real centerpiece of the entire argument. This is the prediction for how this whole story is supposed to end. Here's the predicted chain reaction. First, public frustration grows over high costs and the feeling that their care is being rationed. Second, that anger isn't directed at the complicated government rules that cause the problems, but at the easy targets, the greedy private insurance companies. This creates the perfect political moment for politicians to swoop in and say, it's time to finish the job. And the final step? The U.S. gets rid of private insurers and moves to a single-payer system. Now, as evidence that this was the intended path all along, the source points to this quote from 2013. This is from then Senate Majority Leader Harry Reid, one of the main architects of the law. He straight up calls the ACA a step in the right direction and says the goal is to work our way past the employer-based system. And here's another key piece of evidence highlighted by the source. Remember when the healthcare.gov website had that disastrous rollout? Well, afterwards, the economist Paul Krugman didn't blame the government for messing up. Instead, he argued the whole fiasco proved that the real problem was having private insurance companies involved at all, saying they serve little useful purpose. So at the end of the day, the source leaves us with this really provocative thought. It argues that the high costs, the growing dependence on government, and the public frustration, they aren't bugs in the system. They are the predictable, maybe even intended, steps on a path that leads to one place, a single-payer system. And the question it leaves us with is, was that the plan all along?